Okay. Hi, Kirsten.
Hello.
Hey, how are you doing?
I'm good, thanks. How are you?
I'm well, thanks. So thanks for joining us today. So this is the last of the series that we're doing this week for the Support Don't Punish stream. So yeah, it's really great to have you here, and we're excited for the conversation today. So let's start off. Can you just tell us more about your organization and the support provided for those involved with substances?
Sure, no problem. So I am CEO of an organisation called Scottish Drugs Forum, and the organisation itself has been around since the 1980s. I've been working there for over 11 years, and my background's in mental health nursing. And we are a membership-based organisation. We're a charity. We're a non-government organisation, although we do receive funding from government for some of our core funding. But our aim really is to influence drugs policy and practice to reduce harms and save lives for people experiencing drug problems. So we're not a service provider as such. We don't do direct service provision, but we deliver a lot of training. We advocate on behalf of people who experience drug problems. And we have a variety of projects that coordinate activity across Scotland. And really a key aim for us as an organisation is that we harness the voices of people who are currently experiencing drug problems to make sure that they are involved in influencing that policy and practice change for the better. So we deliver a large programme of peer research, for instance, and really utilise the direct experiences of people to help provide the evidence for what needs to change for the better and to improve Scotland's response to problem drug use.
Wow, okay, that all sounds really great. Thank you so much for the work that you're doing, and for, I guess, giving voices to a lot of the people who usually aren't included in the conversations that should actually be centering them, so should include their voices, right?
Yeah, sure.
You were speaking specifically about people who are using the substances. How about their allies or excuse me, family and friends as well?
Yeah, so in Scotland, we also have a families-focused organisation, Scottish Families Affected by Alcohol and Drugs, that would do a lot more of the direct family support. So we obviously, as part of our work, obviously, when we're doing research and, bringing forward the voices, we would link in and collaborate with an organisation like Scottish Families or hear directly from families' experiences as well. But I think our organisation is mainly focused on the people who are directly experiencing, but for Scotland as a whole, we definitely have organisations that promote the voice of families and make sure that families are also supported going through some of the issues that they're also faced with.
Okay, yeah, that's really cool. And since today's session, we particularly want to talk about stigma. What do you feel about, addressing that? And what do you think are some of the biggest barriers that people face when it comes to stigma and views or opinions about substance users or their experiences?
Yeah. So, I mean, I guess I've been lucky in my work to be able to travel to a lot of different countries and hear from a lot of different people and services and families and people who are using drugs. And it doesn't seem to matter where you go in the world, that stigma is always really evident. I was recently in New Zealand for an event, and some of the stories that were being shared at that event were just so similar to some of the stories that we hear in Scotland from people. I was particularly struck by a woman who was sharing her experiences about being a person who uses drugs and being absolutely terrified to talk to her GP or her doctor about it because she had a child, and just that absolute fear that it would mean that her child would be taken from her if she was being honest about her drug use. So these are sort of things that people in Scotland also face on a day-to-day basis. And, we can put all our efforts into harm reduction and providing good services for people, but against a backdrop of people being criminalised for their drug use, there's only so far that you can take that. So yeah, I mean, we wonder why Scotland has such high rates of drug-related deaths, which are the highest reported in the whole of Europe, when we also have people who are discriminated against in every way, shape and form, who are marginalised, vulnerable, dehumanised, stigmatised, criminalised, and quite often put in prison for using drugs. So yeah, I think the stigma plays in a part on everybody's lives every day. It kills people because it stops people accessing the help that they need. And actually, we still have issues with our services that are supposed to be there to help people still having stigmatising attitudes, particularly I would suggest some of our hospital settings, and even some of our drug services that are supposed to be there to, you know, to provide people with care and treatment, can often have quite punitive practices in place that are not person-centred, that are not trauma-informed, and there's a lot of work definitely that we still need to do to make people feel comfortable to be accessing our services and to be feeling like they can be honest about their situation. And I think that's a real frustration for us, that we see that being a major barrier to accessing services, where people don't feel often that they can be honest for fear of punitive consequences.
Right. Yeah. I mean, I think that's also something that, you know, is kind of the narrative here. And one of the many ways that we try to address that is talking about the spectrum of use, right? Like, it doesn't necessarily have to be only like one side of the story. There can be the whole variety of how people are using it. And like, you know, maybe some of them, it could be, you know, a healthy use or a healthy relationship with substances and stuff like that. And I guess if people don't necessarily have the potential to discover what could be a healthy way for them, then they usually have the potential of falling into unhealthy use, or not really like having agency in how they decide, you know, with substance use. So yeah, and I think, like, you know, reducing stigma is a big part of that, right? With people, with like not only giving personhood to people, but also reducing the stigma around substance use, and how to like figure out what works well for each individual along the way.
Yeah, absolutely. And there are other organisations in Scotland as well that focus on supporting people with harm reduction strategies when it's, you know, non-problematic use, or however people like to describe it. Generally, the work that we're doing is with people who are experiencing really severe drug problems that's affecting their whole lives. But yeah, certainly that is an aspect to it. And I think sometimes there's often stigma that exists between different groups of people who are using different drugs as well. And very recently, there was an example of something that was, I guess, quite shocking to us. So we had an advert out for a position within our organisation, and it was a peer-led project working on the distribution of naloxone. And I put out a tweet that said, we especially encourage people who are still using drugs or have a history of drug use to apply for this post. And there was an article in the newspaper from one of the Conservative politicians saying that, you know, it was, well, it was pretty shocking that we were advertising a post that would be for somebody who used drugs, and that they may still be facing their demons. So there was almost the stigma that, you know, if somebody had moved on from their drug use, that they then wouldn't be experiencing trauma, which was an unusual position to take. But also then it really brought to the fore the stigma about people who use drugs not being deemed capable to work, or that they wouldn't be reliable. And then we really saw that unfold on social media in terms of people who had a history of drug use being very critical of people who were still using drugs. And yeah, so even all these different layers are really complex for in terms of stigma. So we've got so much work to do, and a big aim from that. I mean, we recognise the value in employing people with lived and living experience, and just what I said at the start, there's no way that we could shape our policies and our services without the experience of people who are still facing the problems.
Yeah, definitely. And I think that, like, with I guess the like you said, the stigma like exists in multiple contexts and multiple forms, right? And I guess like at the base of it, there is maybe the sort of normative narrative that people don't know how to make choices, and that's why they are moving into substance use. So there is a lot of like, like policing or surveillance that goes on for people, like even if it's within the community, right? So I think like also recognizing that people are like, they may be choosing, they may not be choosing, but whatever the case is, there shouldn't be judgment about how and why people are using substances, and if they're continuing to, and what they're using and their frequency and all that sort of thing, right? I think there should be more of a push towards like how can we support, how can we make sure that like they are healthy and they are safe, and not like not stigmatizing.
I think the differentiation between the two is important, and people should have the autonomy to decide what substances they choose to use or not use, and that, ultimately all we need to be doing is providing people with the information and the advice to be doing that in the safest way possible without judgment, like you say. But there's also a huge misunderstanding about the reasons that lead to problematic drug use as well, and a lack of empathy, kindness, understanding about some people's personal traumas. Some of the traumas that people have experienced being absolutely unimaginable to most. So I think there's still a lack of awareness and education in terms of that, and also a lack of, I think we need to be better at observing or recognising trauma in early years as well, so that we're putting in preventative measures and supportive measures to support young people that may have experienced trauma from then going on to, to experience drug problems. And I think another area that's undervalued or underexplored, I guess, is about neurodiversity, and we're seeing a lot of that at the minute in terms of people with undiagnosed ADHD or other neurodiversity that has potentially led to substance use. That, so it's not been anything particularly traumatic, but there are actually reasons that people go down particular paths. And I think the strong voice that always comes across sometimes in the media is that it's a lifestyle choice, and I think it's far more complex and detailed than that, and that's really dismissive, I think, a way to describe people's experience.
Yeah, I agree. Like it really reduces it to only one narrative, and as though there's only one like way of experience. And which is why I think, as we've mentioned, it's so important to make sure that we hear the voices and that we have the people who have lived and living experiences to sort of like, be spearheading or at least supporting like a lot of the work that's done around harm reduction. So like, in a similar vein, like how do you view harm reduction like becoming more mainstream, particularly culturally?
Yeah, so in Scotland in particular, we have a huge variety of harm reduction approaches. So we have naloxone, a really excellent national naloxone programme. We have widespread injecting equipment provision. We have medication-assisted treatment. We have, safer injecting advice and guidance. So we have a huge range of things on offer to people, but the things that we do have, we don't capitalise on enough. So we need to upscale everything that we are currently doing. So, for instance, we have widespread injecting equipment provision, but there'll still be areas in Scotland where if you're in a rural area, for instance, it's harder to access, or, if you require drug treatment, so medication-assisted treatment, it may be more difficult to access depending on where you are in the country. Or we've just recently introduced medication-assisted treatment standards, which is excellent for Scotland, but these are things that will improve the speediness of somebody getting access to treatment. So it used to be the case where people would have to wait weeks or often months to access a medication, for instance, like methadone or buprenorphine. And now the ambition or the standard should be that anyone who wants treatment should access it on the day that they ask for it. So that's a big change in culture for our services, and something that's taken a long time to get into place. People should also be able to have choice. But at the moment, the only choice really is methadone or buprenorphine. So we need more injectable options. There's only one area in Scotland that provides heroin-assisted treatment. So we definitely need to be providing more choice. But choice also means choice about how often you need to go to the chemist or what your dosing should be. So giving much more autonomy to people to make their own decisions rather than a paternalistic approach. The things that we don't have in Scotland are, we don't have drug check-in facilities, we don't have drug consumption rooms, despite the clear need for these, and a huge number of areas experiencing outdoor injecting, people injecting in outdoor spaces that would absolutely benefit from a safer consumption facility. And an HIV outbreak that happened in Glasgow city centre in 2015 amongst people who are injecting drugs and using heroin and cocaine. So we don't have the facilities that we need for everyone, and we also still criminalise people who use drugs. So I think in order to go back to your original question, because I've sort of slightly gone off track, I think more education, more evidence-based approaches, and more education about the benefits of harm reduction and the need for these facilities are important. We have problematic rhetoric around abstinence versus harm reduction that can be difficult, and especially undermine harm reduction approaches when the view may well be that recovery equals abstinence, which is obviously isn't the case. And we really need to reframe that discussion that, you know, it's all about people's quality of life, and the only person that can determine how good their quality of life is the person who's living that life. So I think underlying all of that is addressing stigma, and we'll only do that by continuing to have conversations like these and doing wider education on the issues.
Yeah, definitely. I mean, like as part of this series, we also spoke with some people in Australia who provide harm reduction services. Yeah, and one of the people is from the medically supervised injecting room. So like you were saying about how, you know, Scotland has a real lack of the services. In Australia as well, I think they don't have that many, but hearing from like people who are working there, and like also the people who use the services, and how it's such a stigma-free environment, and how, you know, it's very much, the journey is based on what the client comes in with, and how they want to use, how frequently they want to use, and that sort of thing. And the service is just to make sure that they're healthy, they are safe in the process, you know. So yeah, definitely we need a lot more of that kind of support.
And also it's the types of services that we provide as well. How are we effectively engaging with people? Because people will often come to services or come to a place where they can access different types of service provision because of the people who are running the service or the people who are working in the service, because it's peer-led potentially. We don't have enough peer-led approaches. But also people might come to a safe place to get a cup of tea or to get some food or to wash their clothes or to have a shower. So if we had more services that offered that as the first point of contact, and by chance they also offered prescriptions or injecting equipment or naloxone or whatever, but that wasn't the reason why people were coming. They were coming because of a different reason, because it met their needs in another way. And the more they would come to that type of service, the more comfortable they would feel with the staff, the more that they would see that they weren't being judged, and they were given the time to build up that confidence and a bit of self-esteem, where they would then think about access and other things that might improve their quality of life. I just think we've got our services a bit backwards sometimes. Like, we'll set up services that are very clinically led, and people come and they have like guidelines and rules that they need to abide by to access a particular service, where actually if we flip things round a bit and just made nice environments for people to come in to feel welcomed in, I think we would do a lot better in terms of our engagement with services and how we attract people into our services as well.
Yeah, for sure. I completely agree with a lot of the things that you said. And I guess, like, you know, part of that, I mean, we're talking about formal services, right? But if we also talk about friends and family support, so one of the audience questions was like, how many families does your organization support? And maybe to also expand on that, you know, like, do you also work with drug users and their families in advocacy work?
Yeah, so not so much so, because like I said, we're not a direct service provider in terms of that. So we would be, our role in that would mainly be about sometimes we get inquiries through about service, so we would provide people signposting to services and to advocacy services and to other services like that. But the other organisation that I mentioned, so Scottish Families Affected by Alcohol and Drugs, they absolutely do provide that helpline support and provide the support directly to families in terms of focus groups and support groups and one-to-one support for family members. And they support families across the whole of Scotland. So, you know, they'll support hundreds of families with whatever they require. So not so much in terms of that, but where we have supported Scottish families with a project that really helped get naloxone, for instance, into the hands of family members. We worked with Scottish families to help them set up a click and deliver naloxone service. So basically anyone in Scotland can go online and go onto the Scottish Families website and order their own naloxone kit, and it'll be delivered to them discreetly in the post. So I guess that's some partnership working that we do with organisations to help family members be equipped for responding to overdoses from their loved ones, but also just to promote the message around how to save a life. And that's a big part of our work, is about trying to prevent drug-related deaths. We ran a campaign last year, How to Save a Life, and we had TV adverts, billboards, signs on buses, radio adverts, a huge promotional campaign that sought to inform the general public about how to recognise an overdose and what to do in case of an overdose. And that also included a link to Scottish Families Service for support and naloxone provision. So yeah, so that was a long way of answering the question to say that, yeah, we don't provide that direct support, but definitely that happens in Scotland.
Right. Yeah. I mean, I think you also quite, you know, a few times during the conversation, you've pointed out about the, you know, like the prevention of drug-related deaths, and that's how, like, that's quite a primary focus that you work on, right? So that ties in pretty well with like one of the other audience questions, you know, like you mentioned that Scotland has a high rate of drug-related deaths, and if this were in Singapore, it would possibly lead to people saying that therefore there needs to be more policing, there needs to be more criminalization and harsher penalties, right? So do people in Scotland say the same? And if they do, like, how can we advocate and push back against that kind of mindset?
Yeah, no, it's a great question. And when I was in at the International Harm Reduction Conference in Melbourne recently, it's always a stark reminder about some of the human rights abuses in other countries, because that's not the same type of policy that we have in Scotland. So we have a very different approach here, and certainly Police Scotland have adopted much more of a public health response to policing, and they see the value in a harm reduction policing response. However, they're doing that against a backdrop of enforcement, because obviously they are still employed to and guided by the Crown Office and the legal structures that surround the work that they do. So there is still that difficult balance with enforcement and harm reduction and public health. So it's still a complicated territory, but certainly there isn't calls for, you know, a much harsher response to problem drug use. If anything, it's going in the opposite direction, where we see that policing needs a much better and more informed harm reduction public health response. But that needs to come with law reform, you know. So we have a slightly different situation in Scotland, where some of the government powers are devolved to Scottish Government from the UK Government. But the Misuse of Drugs Act, so drug laws, are not devolved to Scotland. So we require to have changes through the UK Government that could be implemented in Scotland. However, saying that, we do also have like a chief legal advisor, law person in Scotland called the Lord Advocate, who can make changes or provide guidance to Police Scotland to not prosecute in certain circumstances. So most recently, we've seen a provision where the Lord Advocate provided a prosecution waiver or a letter of comfort to police, so that if somebody was found in possession of drugs that were for personal use, they're able to provide a recorded warning rather than, you know, instantly a court order or whatever would be the correct description in your area as well. So that helps, and that helps the direction, but it doesn't go far enough. So yeah, there are still major changes that we need to our drug laws. I mean, the Misuse of Drugs Act is from the 70s, and things have moved on a lot since then. So it's things like that that prevent us from operating drug consumption rooms that would be of huge benefit. But we as an organisation firmly believe that the Lord Advocate in Scotland has a place where they could be directing the police to allow the operation of a safer injecting facility. So that's where it gets into political territory. And the drug consumption room issue, for instance, has been something that has been caught up in politics. So that's really unfortunate and is delaying essential care that we could be providing to people who use drugs.
Yeah, I think yeah, I mean, multiple things have to happen concurrently, right? Like it's hard to get one thing going if like other things are sort of like acting as barriers or preventing like changes from happening, which actually leads us to the final question. But before I ask that, I just wanted to remind the audience, like if you have any questions, please feel free to like add them into the Q&A chat box, and I'll read them out to Kirsten as we go along. So we'll just have the final question for now. How can we build more community capacities to provide harm reduction in informal settings too? So for example, with family or friends or community centers, you know, not just with professional harm reduction services.
Thanks. Yeah, I think we've also covered some of that in what we've been discussing, just about how we provide our services and what our traditional thinking about a service is. So I think more peer-led approaches are absolutely required, and I think that provides just a different way of getting the message out to communities in a different way, and often in a much more effective way when we're talking about peers going into peer communities. For instance, I would like to see us having much more. We do have peer-led naloxone provision, for instance, but those are quite formalised programmes. I would like to see a sort of less formalised way of that happening that also incorporated provision of injecting equipment, safer injecting advice, and all of these things that could be on a much better peer-led approach and designed by peers and led by peers. And I think that would provide a really good bottom-up approach to shaping services. I think we've done, I mean, I keep going back to naloxone because it's the easiest example that I can think of in terms of how we've managed to provide more naloxone provision or more harm reduction provision through different groups. So we've managed to change regulations or loosen up the restrictions about naloxone provision that's allowed family members and others to have more of a harm reduction approach. And with the campaign that we did, it really encouraged members of the general public to get more involved in saving lives. And I think any service or any organisation or any group that is providing a service or support to people who use drugs should be considering what their potential role is in whether that's advocacy or signposting to services or actually having equipment available. We've seen really good examples of services that are maybe not a traditional drug service, so maybe have been something like a laundry service, that they've wanted to produce a laundry service, but that also has an element of advocacy attached to it or whatever. So yeah, I just think reframing what we provide, what do people actually want? Because if we're talking directly to what people want on a day-to-day basis, often it is just about a safe space, somewhere where they can either use their drugs or somewhere where they can just get a cup of tea and something to eat. And then just thinking about how we design our service provision around what people actually want rather than what we think is the best way to do it. I don't know if that really answers your question, but it was hopefully covered in a lot of the other bits that we discussed as well.
Yeah, definitely. I mean, I like your example of like, you know, a laundry service also being able to provide things, because that's really what it is, right? It's like just supporting in life, like everyday things that we all need to do and where we all need support, and where, you know, like, I guess it doesn't always have to be only focused on one aspect of a person or their life, right? Like, and I think people who provide the professional services have also spoken about that, because there is a safe space there. So people come in, they can talk about housing, they can talk about finance, they can talk about relationships, they can talk about their family. It's just like a space where people feel like there's no stigma. So they're able to like just be free and be open and be comfortable in talking about, like, you know, life in general and the potential struggles and what kind of support they need or that they could benefit from.
Yeah. But, there's a really good service in Glasgow run by Simon Community Scotland, and it's called the Access Hub. And it's probably the closest that I can see that we've got in Scotland to the type of service that I guess envisaging when we think about that. And it's really, really well designed. It's really nice. Like, it looks like something you would walk into like a hotel. Like, it's really well furnished, and it's for people who are experiencing homelessness, and they can come in and they can use a phone, or they can speak to somebody like about all those things that you just mentioned, or they can just come in and, you know, get a cup of tea or speak to a member of staff, and the staff are really supportive and welcoming. And it's just such a nice space for people. So then they're able to bolt on other services to that. And they maybe have other services doing in-reach into the facility. So yeah, there's that way of thinking, I think, something that we need much more of.
Yes, I completely agree. And I hope that, you know, like in whatever capacities we all as individuals or as a group are able to, that we can continue to provide, you know, just safe spaces and look after and help out with each other.
It's just about being kind to people.
Exactly. Yeah.
It's such a sad state of affairs that we have to remind people that people who use drugs are human beings, and, you know, just not judging people on what your perceived thoughts are about what their situation is. And, you know, some of the nicest people I know are people who are experiencing some of the biggest hardships and biggest issues in their lives. So yeah, it's just, yeah, those preconceived ideas about people is, you know, something that really needs to be addressed, and just being nice to people goes a long way.
Yeah, I completely agree. Thank you for saying that. It shouldn't need to be said, but like, yes. Yeah. So yeah, I think we're coming close to the end. Are there any final thoughts or comments that you would like to add in, Kirsten?
Yeah, I mean, there's just so much. I mean, I guess Scotland is in a horrendous position because we have such high rates of drug-related deaths that are often included in the same conversation about that, like the USA and Canada, much bigger places than Scotland. Scotland's got a population of just over 5 million people, around 60,000 people experiencing drug problems, and over 1,000 people dying from preventable deaths every year. And, you know, the last year that we have the numbers for, that was 1,330 people lost their lives. Every single one, somebody's son or somebody's daughter. And I think sometimes we get caught up in talking about numbers and we forget about the real impact on people and their communities and the wider impact that has. And it's likely that we'll see a slight reduction in the numbers of drug-related deaths for last year, but it'll still be well over 1,000. So, I mean, the scale of it is huge for a small country. So if we were to, for instance, experience an influx of fentanyl or synthetic opioids, we're not prepared for it. We're already not managing in the way that we should be. We're not managing to help people in the way that we should be with our current drug problem. Never mind if we were to see a change to the drug market that brought us an even more toxic supply. So yeah, we just need to upscale. I spoke recently in a evidence session to Parliament that, you know, we've made a lot of progress because we now have a specific drugs policy minister, which, well, she's now actually drugs and alcohol policy minister, which is so useful for Scotland to have that on, that's actually somebody's full remit, because that's never been the case before. And we have a national mission on drugs. So the Scottish Government released a lot of funding into this area. So a huge amount of funding over the course of Parliament for 5 years. But we're now 2 years into the national mission on drugs that's supposed to reduce harms and save lives. And whilst there has been some progress, it's nowhere near enough. So we need to get this right, and we can't be looking back in years to come regretting what we could have and should have done. So now's the time for major change, and we just really need to get on with it. So that's the position we're in at the moment, and you know, hopefully we do see that significant change.
Yes, I completely agree. Thank you so much for talking about that. Like, I think, you know, even if there are harm reduction services that exist, like, it's important to, like, you know, to expand on those, to develop those, to continue those. You know, can't just sort of take a back seat and let things slide. You know, I think it's high priority, high importance, and we definitely have to put focus on that.
And I know that, and countries like ours are in a privileged position to actually be able to do that, because we don't have a lot of the problems that other countries have in terms of death penalty and, you know, some really significant human rights abuses. We don't have that. I mean, but we certainly have issues, and I'm not saying that we have brilliant human rights for people who use drugs in Scotland. We've still got a long way to go in terms of that, but we do have the opportunity, and we have, you know, we need to embrace the opportunities that we do have to be able to push for change. So yeah, it's saddening coming to other and hearing from other countries about some of the horrific experiences for people, knowing that we could actually be doing better and that we have it within our powers to do that. So yeah, we need to take that on board and do more.
Yeah, I mean, I think similarly in Singapore, even though we do have the death penalty, we actually like have, you know, the potential for resources and for funding and all those sorts of things, which could be like, you know, moved into areas that could actually be more supportive.
Yeah, it's actually so inspiring to see countries that have all these these issues, but are still able to provide services for people who are experiencing drug problems. I think it's massively inspirational to other countries as well to see, well, and sometimes actually that practice is a lot more innovative than in the countries where actually we do have a lot more resource. So we can learn a lot also from the way that people are just so innovative under really difficult circumstances.
Yeah, definitely. Yeah. Our session yesterday was kind of along those lines as well.
Okay.
But yeah, agree with what you said. Well, thank you so much, Kirsten. Really appreciate, you know, you sharing your experiences and talking about the situation in Scotland. And it was really eye-opening to hear a lot of the stuff you were saying. Yeah, so I just wanted to remind everyone that TJC, the Transformative Justice Collective, we're having Abolitionist Festival the 8th and 9th of July and the 15th and 16th of July. We also have one over the first weekend of July. So you can look at TJC's website to find out more information. Kirsten, is there anything that you would like to sort of bring people's attention to?
No, I'm happy to share any resources or any links that I mentioned while I was talking, and happy for my email address to be shared as well if anybody wants to get in touch. So but thanks so much for having me.
Thank you, and have a good rest of the day. Thanks again for joining.
Cheers.
See
Bye.
you. Bye.